Welcome to the show. This week's topic is going to be about sleep. Now, did you know 35 million Americans do not get a good night's sleep? And what do you think happens with this? It leads to all kinds of trouble. Trouble in the workplace, falling asleep at your desk, unproductive lifestyle, too much stress, and not to mention all the highway fatalities and accidents that people get into just because they're driving while they're sleeping, either falling asleep at the wheel or not getting enough sleep. In this show, we're going to talk about a lot of the common problems that people have. We're going to talk about some of the types of sleep disorders. We're going to bring an expert in from the Sleep Center, and she's going to talk a little bit about some of the patients that she sees on a daily basis. And then we're going to talk a little bit about the treatments and what you can do to get a better night's sleep. Now, before we start, we're going to talk about some of the problems. Now, do you find yourself walking around with a cup of coffee all day long? Do you find yourself getting into the cabinet to find a Benadryl or a Tylenol PM or something to help you sleep? Do you think that drinking a glass of brandy before you go to bed at night is going to get you a great night's sleep? Or even worse, do you think you sleep really well but snore all night and your spouse doesn't get any sleep? All these kinds of things are actually curable and sometimes preventable. We all have a lot of misconceptions about what makes a good night's sleep. We all think that a lot of things cannot be treated. So at the end of this show, I want you to understand what entails a good night's sleep, what you can do to help yourself get a restful sleep, and who you can go to and what you can do for any type of treatment or help with your sleeping disorder.
Well, I've had a problem sleeping for a few years now. I can fall asleep real easy, very quickly, but then every hour, every couple hours, I'm wide awake. So I'm up and down all night long. I've tried the prescription sleep aids. They just make you feel all groggy and you just can't get motoring in the morning. I've just tried all sorts of things. It's a chronic problem.
And today, as our special guest, we have Tammy Martin, who's a PA from the Sleep Center at UHS. Welcome, Tammy, to the show.
Thank you.
And what are some of the patients that come and see you?
The majority of our patients come because they're tired. They're diagnosed with obstructive sleep apnea, but we also treat narcolepsy, restless leg syndrome, CNS hypersomnia, circadian rhythm disturbances.
And just in a nutshell for our audience, in layperson's language, what are some of these things? I think we all understand what sleep apnea is, people not getting a good night's sleep because of snoring and other things like that, but some of the other disturbances that you mentioned, just briefly go over those.
Narcolepsy, people have sudden attacks of sleepiness throughout the day. They can become weak with emotion and collapse to the ground. That's called cataplexy. Some people are excessively sleepy. That's what the hypersomnia, CNS hypersomnia is. The circadian rhythm disturbances, some of the teenagers who go to bed late, get up late, jet lag.
That seems to be like all teenagers.
That is all teenagers.
Go to bed late, get up late.
Yeah.
Okay. And have you found that the number of patient visits to your lab has been increasing over the years, or has it been decreasing or staying about the same?
It's been increasing, and I think that's because primary care physicians are becoming more aware of sleep and asking their patients how they're sleeping, and if they're not sleeping well, then they refer them to us.
Right. Now, we all know with sleeping, there are many factors that control how we sleep, how long we sleep, and I think one of the main things that everybody wants to address is how does stress involve itself with sleep or lack of sleep?
Stress can cause a lack of sleep because people tend to lay in bed at night and worry. They worry about finances, they worry about their job, the economy. That stimulates them to become more awake, and it takes them hours and hours sometimes to fall asleep.
Right. So one of the things that basically, I think all of us as healthcare providers and also as people who are watching the show, if there's a way that they can resolve or decrease their stress level, it would definitely help them sleep. Is that correct?
Absolutely.
And some of the things, it's not like the worries are going to go away. I think everybody still worries about their children, worries about their monthly bills, about how their business is going to survive, their dog's diabetes, or whatever else is in their lives. But I think if there's some sort of an outlet and some sort of stress relief, and there's many methods that we can talk about with that, but that's going to help people get a good night's sleep then, right?
Yes, and also learning how to deal with the stress that they can't eliminate. That will help too.
Because I'm sure there are some people out there who don't have any of those disorders that you talked about, that just are worrywarts. They just worry about everything. They worry about the weather, they worry about whether the Mets are going to win, they worry about everything. And they just have that personality where they just can't seem to stop worrying. Now, what do you tell these people?
We go over good sleep hygiene with them, make sure they don't drink caffeine after in the afternoon, don't exercise right before bed, no heavy meals. If their sleep hygiene is good and they still tend to lay awake because they're worrying, we actually send them, there's a psychologist in the area that teaches something called cognitive behavioral therapy, and they teach the patients how to shut their mind off and how to relax and fall asleep sooner without using medications.
All right. That's one thing that you mentioned, is learning how to shut your mind off. You know, I think we should look at our mind as your computer, you know, where if you're running a bunch of applications and programs, the last thing you want to do is just go push the on-off button and shut the whole thing down. I mean, you can do that, and I'm sure some of us do it every once in a while, but it's not the right thing to do. And I think your brain is kind of like that, where you kind of have to close all the windows first before you turn it off, you know, to allow yourself, because basically what sleep is doing is helping your brain kind of reinforce and rejuvenate, and it's like a health spa for your brain, right?
Yep.
Well, let's go over some of the more specific things. Like, say, you know, we always get on an aircraft, or you get on a bus or a train, the guy next to you is snoring and snoring and snoring, and not only is that person probably not getting a good sleep, keeps everybody else awake too. How much of this do you see?
Probably 80 to 85% of our patients come in with the symptoms of snoring.
Now, are they being dragged in by their spouses, or
A
are
lot
they
of times
voluntarily
they are.
come in?
A lot of times they're there because their spouse can't sleep.
Right. And do all these patients have what we call sleep apnea, or is it just some people just snore?
Some people can just snore, but the only way to definitively tell is to have a sleep study, and that will tell us if the snoring is associated with sleep apnea.
Okay. And what's so important about it? I mean, some people would say, yeah, I snore, you know, so what? Not my problem. Nobody can hear me anyway, right? Because how many snorers come in and say, I don't snore?
Most, yeah, a lot of them.
Right? So,
Right.
I mean, they feel that it doesn't bother them, but there is some science behind that. It is a problem, right?
Right, because when you snore and you have sleep apnea, the tissues in the back of your throat collapse and obstruct your airway while you're sleeping. That in turn makes your oxygen levels drop, and that in turn can put a stress on your heart. Cardiovascular system can cause high blood pressure, put you at a higher risk for stroke, heart attack.
And this is something that the risk accumulates over time, right? Or is it
In
something?
the sense that sleep apnea can worsen over time because it's affected by age, weight, and anatomy. And age and weight seem to go hand in hand.
Right.
So as people get older, their apnea tends to get a little worse.
And what kind of treatments are there for this?
There's a variety depending on the severity of your sleep apnea. If you are mild, you can work on weight loss. There are dental devices that you can wear to pull your lower jaw forward, which in turn will pull the back of your tongue forward, which will open up the airway a little bit. There is a surgery that the ears, nose, and throat physicians do, and they trim the soft palate and try and remove tissue out of the back of your throat to open up the airway surgically. The most effective treatment is CPAP, which stands for continuous positive airway pressure. That's a mask you wear over your nose when you sleep, and it exerts positive air pressure and acts as an air stent to keep those tissues open.
Okay. And one of the problems with not getting a good night's sleep or sleep apnea is that you feel tired the next day, right?
Correct. You don't get into the deeper restorative stages of sleep because your body wakes you up when your oxygen levels drop and you arouse to a lighter stage of sleep. You breathe, you try and get back to the deeper stages, your airway obstructs, and it just goes on many times an hour all night long.
And people have a good response to these types of treatments?
Yes, yes, they have told me it's been life-changing for them.
And their spouses, I'm sure.
Yes, their spouses are happy.
Right. Now let's move on to something else. When we talk about, getting in certain behaviors for a good night's sleep, like some people would say, gee, I like to have a warm glass of milk or a little sip of cognac or brandy or something like that to help you sleep, or I watch a boring show. Are these kind of things, are these just myths, or are these kind of things that really help you get a good night's sleep?
It doesn't help you get a good night's sleep. Some people feel that it makes them fall asleep more quickly. Alcohol will make you sleepy, but it is a poorer quality of sleep once you get to sleep. It will be more fragmented.
So you wake up many times during the night.
Correct.
And not only that, if for those people out there, if you drink alcohol before you go to bed, chances are you're going to wake up in the middle of the night to urinate at some point.
Yes.
Right, which is not conducive to a
And
good
you
night's
snore
sleep.
more.
And you snore more, which is not good for family life, right?
That's right.
What about exercise?
Exercise, if it's in the morning, tends to make you sleep better at night. You don't want to exercise right before bed.
Is that's vigorous exercise we're talking about, or is it taking the dog for a walk in the evening?
Cardiovascular, 30 minutes of cardiovascular exercise.
Right, okay. Some other things that people always do in this day and age is everybody seems to have a television in the bedroom.
That's not a good idea.
And that's not a good idea. And there's something about light and sleep, right?
Yes.
And can you tell us a little bit about that? What's important about darkness? What's important about light?
There is a hormone called melatonin that your brain produces, and what triggers it to go on and off is light. So when it gets dark out, it produces melatonin. That's what makes you sleepy. And then in the morning when the sun comes up, it turns the melatonin off and tends to wake you up. So these teenagers that can't sleep are in front of the computer, which is simulating the sunlight and keeping them stimulated and not allowing their body to produce what it needs to become sleepy.
No, which is one of the reasons why a lot of the kids go to school very tired, and then it leads to not paying attention,
Correct.
poor exam scores, whatever it may be.
If they even go to school. A lot of them won't even get up to go to school. We see a lot of patients, their parents bring them because they can't get their kids to go to school.
So basically it's take away the computer, the cell
Basically,
phone,
yeah.
things like that. And that's probably one of the reasons why we have these little night lights that are more soft light, things
Correct.
like that. That you don't get up in the middle of the night and then flip on all the lights in the house. Chances are you probably wouldn't be able to go back to sleep.
Right.
Is that correct?
Yes.
Now, we all think that as we get older, we need less sleep. I know that my parents seem to go to bed at 10 o'clock and wake up at 4, and they seem to be waking up earlier every year. Is that something that happens with age, or is it just that elderly require less sleep than middle-aged or younger adults?
What tends to happen with age is they go into what's called an advanced phase. The teenagers go to bed late, get up late. The elderly tend to go to bed early and get up early. It's not that they require less sleep. Plus, a lot of them nap during the day. If they're bored
Right.
or tired, they'll just sit and nap because they can.
Sure. Don't we wish we all could nap during the day, right? That's something
Yeah.
that we all feel, wish we could do.
8
Are there-
hours is a good number to go by, but it's not written in stone either. Some people do fine on 6 hours. Some people need 10 hours. You go
Right.
by what your body tells you, how you feel.
So basically it's trying to go to bed at a decent hour without too many stimulants around you, try to relax more, try to de-stress, and wake up when basically the sun comes up.
It's important to have a consistent sleep schedule. You go to bed and get up at the same time every day.
Now, one of the things that probably plays a factor, but people don't think about, is also comfort. My dad always used to tell me, don't be cheap when it comes to your bed and your shoes because you spend most of your life in them.
That's right.
And when we're spending a third of our life in our bed, if you sleep on a very uncomfortable bed, or a wooden board or whatever it is, it's not going to be conducive to a good night's sleep, right?
Right, and you have to make sure the temperature of your room is cool enough or warm enough for you. Environmental factors play a big part. If you live in the city and there's sirens or garbage trucks going by at 2 o'clock in the morning, you're going to have a poor quality sleep.
Okay. Now, tell us a little bit about that sleep environment. And we have lots of people, and some of you out there, you know, you sleep with your dogs and your cats and your children, and open all the windows on a busy street, and have kids having parties in the house in the middle of the night, and all these different things. Comment a little bit about that.
I see that a lot, especially people sleeping with pets in their beds or children in their beds. You're not going to get a good night's sleep because when the dog rolls over or when the baby moves, you're being woke up out of your restorative sleep. So no, none of that's a good idea.
And the dog probably has a chance to make up that sleep the rest of the day.
That's right.
And we don't.
But most people will not put their dog on the floor. They like to sleep with them.
Right. Now, say, you know, somebody out there says, you know, gee, I'm working too hard, or for whatever reason I'm stressed and I'm not really getting good night's sleep. When is the time to come in and have a sleep evaluation done?
When you feel that it's impairing you functionally, you can't do what you'd like to throughout your day, it's interfering with work, you fall asleep at your desk, or some people will go to the restroom and take a nap during the day so they don't get in trouble, sleep at their lunches.
Right. And there is help out there for these people. So if you're out there and you don't feel like you're sleeping well, you don't feel productive at work, or someone's telling you, you know, waking you up at your desk, that's the time to come in and get some help. And there are providers out there that need to be aware also that this does exist, and there are causes of this, and it is treatable. And I think the public needs to be aware this is also a treatable disorder, right?
Yes. And if you're tired, come in and see us. If you don't snore, that doesn't mean that there's not a sleep disorder that we could help you with.
Well, thank you very much for coming on.
Thank you for having me.
And happy sleeping.
One thing I have found that helps is I try to stay away from the television and the computer the last hour or so before I sleep, and I do use essential oils. I use lavender and put that on my temples and around the back of my neck and on my pillowcase to help me sleep.
Thanks for joining us for today's show on sleep. I hope you learned a lot, and I hope you enjoyed our expert, Tammy Martin from the Sleep Center. One thing we didn't get into was some of the medications that are out there, and I'm sure you've all watched television and seen the commercials for Ambien and Roserum and all these different sleep aids. One thing to be careful of before you go and ask your doctor for sleep medication, or even use over-the-counter stuff like Benadryl or Tylenol PM, These are only short-term fixes. Even the over-the-counter medications are addictive and have some hangover effects. Now, the medication is only for short-term use. It's not something that you need every night to help you sleep. And if you're watching the news lately, just look at Michael Jackson. He was on so many sleep medications basically because of probable medical causes and psychological causes of not being able to sleep. So if you feel that you can't sleep and you need medication, or you're using your medication on a daily basis for a long period of time, make sure you seek professional help. The other thing is also make sure your environment to go to sleep is good. Make sure you de-stress. If you had a hard day at work and you're all wound up at the end of the evening, don't go to the bar and have a cocktail. Make sure you de-stress. Sit in a relaxing environment. Talk about the problems. Unspool the whole business of the day so that when you do finally go to sleep, it's nice restorative sleep and not agitation and worrying and being stressed about all the daily events. Make sure your room is comfortable. Make sure your dog or your kids or your cats are not in the bed with you, because chances are they'll get a good night's sleep and you won't. Make sure the temperature is correct. Make sure there's not a lot of noise. And for God's sake, get the TV out of the bedroom. I hope you have a good night's sleep tonight, and join us next week when we talk about nutrition.